Ours is hyperthyroidism.
Good morning.
Hey, how are you doing?
I'm doing good.
Tuck. So we just did shift change. I'm coming in and kind of finding out a little bit about what's going on with you guys. I know the doctors come in and talk with you. A lot of times they go through things really quick. So I wanted to find out if you guys had any questions, where I could break things down, apples, pears, bananas, and just kind of get a look at you guys. Now this is James, Ethan James.
Ethan James, he likes to be called James.
Hey James, I'm Tuck. It's nice to meet you. And I guess this is Mom.
I am Mom.
All right, it's nice to meet you. James, is it all right if Mom hangs out while we talk? All right. Look, what I'm going to do is I'm going to bring up a chair so we can sit and chit chat, okay? All right.
They did give James something for pain early, so he's like a little out of it or whatever. You know, he does have ADHD, so you know he's kind of a wild child.
Oh, I understand.
His medicine kind of kicked in. So.
I'm a fellow ADHDer myself, so I get it. So tell me a little bit about what's been going on with him.
Well, we brought him in. He's been kind of restless and like sweating and stuff, so we kind of thought it was like his ADHD, you know, because we have changed like medications like 3 or 4 times.
Okay.
We try to get like a good regimen for him. He had it for like the last about almost 4 years with his ADHD. I really didn't want to put him on any medications, but we saw at least about 3 or 4 specialists, and it just means just being a nurse. I don't do kids, I do little old people.
Right.
You know, and he was just exhibiting a lot of the issues my little old people have, and I was like, no, something got to deal. So he started doing good on the medicine, was able to concentrate. Grades never really dropped, but they did get a little bit better. But he started getting restless, and he started getting irritable, you know, didn't want to eat or anything. And I noticed that he had started losing weight. And he told me that it felt like his heart was racing coming out of his chest, and he just felt all bad and everything and stuff. So me and his dad kind of like put him in the room with us to kind of sleep, and that was a bad idea because he was kind of like all over the place in the bed. So
with his feet in your back,
feeding my back, feeding his neck, and it was just like a whole hot mess. So I was like, okay, we kind of like need to bring him in to figure out what's going on. So they ran some labs and stuff on him, and they said his stuff was looking kind of funky. And so they admitted us, and that's kind of like where we are now.
Okay, so whenever he initially got diagnosed with ADHD, did they do blood work and all of that to check different levels?
They did. They actually checked his thyroid, and they said he's kind of like borderline, for us like with hyper or whatever, but it wasn't nothing to like kind of be concerned about because
just
they thought it wasn't like just out of the norm. So they really felt like they thought it kind of was that or whatever. But they did other tests, and the things that he's exhibiting at home is the same things he's exhibiting in school. So they said, okay, yeah, it's ADHD.
Okay. Well, so looking at what the doctors put in his notes, they are concerned that it is hyperthyroidism.
Okay.
And his levels are, you know, kind of out of whack there. And he got diagnosed at 8, is that right, with ADHD? Okay, so when did they put him on the Pramlol?
He's been on it about 8 months or whatever. That was also like an adjunct, kind of like kept him focused on his test or whatever.
Right.
With anxiety, that was like kind of one of the things the doctor said, okay, let's put him on like a low dose of that. And they kind of like help, not only give it to him like on test days. He don't have to take it every day.
Okay. Well, I noticed that it said in the chart it was 3 times a day. I'm like, golly, 12 years old. And
yeah, so I kind of like told that nurse in the ER, you know, we went to nursing school together. She thinks she knows, but she don't know. Yeah, so, you know.
Look, I'm learning every day. What you talking about?
So, and I told her that when she was like, no, if he's having these, he's supposed to take it 3 times a day. I said, he's a little person. Yeah. A little person. And I said, clearly, put your glasses and contacts on because on the bottom it clearly says PRN. And then she goes off and tells me that the pharmacist didn't know what he was doing and he put it on the bottle wrong. Okay. So that's a whole nother issue I got to take up with the administration.
Well, one of the things that I would like to kind of do is get you guys set up with a pediatrician. Get a visit with your pediatrician so that we can kind of go through the different meds, go through the different changes that we're going to be dealing with as far as our medication and and our diet and everything like that. I also would like to, does he see a pulmonologist?
He does.
Okay. There's a couple of things that we might want to tweak, talking with your doctors. So if, is it all right if I go ahead and get a listen to him? Okay.
If he don't fight you, but yeah, you can.
All right, bud.
Because you're working him out his nap that
All
time.
right, I'm gonna be gentle. All right. All right, so I'm guessing the medicine's kind of slowed his heart rate down a little bit. He seems to be tagging along pretty good. Didn't hear any wheezing or anything like that, so that's good. How often does he do his rescue inhaler?
We do his rescue inhaler. I got him into soccer or whatever, so we kind of like do that because I got him on some of that energy off.
Oh, I know.
The next thing is he wants to try to do football later on. But my concern was that he was losing a lot of weight. I try to give him a good healthy diet or whatever. He like his dad like to give him junks because he's a junkie or whatever. You know, he like that junk food crap. And I try to educate him on the types of foods. So my thought process is that I like to give him like the lean chicken and give him like the broccoli and the green beans and like a starch or something like that.
Right.
And versus my husband wants to give him chicken nuggets and French fries, you know.
Well, you know, I've got 22-year-old kids that all they eat still is chicken nuggets and French fries. So it's easy, and you know, guys are just gonna do their best to make it all easy. They're typically not the ones that are gonna get in the kitchen and try to make a big old meal. So with him being diagnosed with hyperthyroidism, he's got, as you know, his thyroid, you can either be hypothyroid or hyperthyroid. Hypothyroid, and you're just kind of sitting there, you know, it's very sedentary, you don't really have the energy to do a whole lot. Where on the other end of the spectrum, he's hyperthyroid.
On top of ADHD.
Well, and so that was one of the things that I was wanting to discuss with you. So whenever they said that he was borderline, when they did those initial tests, he's got a lot more hormonal activity going on now as a 12-year-old. And I'm wondering if perhaps that ADHD diagnosis was actually being kind of brought about from his thyroid overacting thyroid activity.
And I kind of questioned that too because it was borderline or whatever, but he was a straight A student. I started noticing those grades kind of like tapering down or whatever, and the irritability just really got worse when he wanted to like kick people in the face at school or whatever. So I was looking more like maybe it's that because they gave him all kinds of stuff because he's very smart. They're very smart. You know, they would give him stuff to do and he'd finish it like that. So it was like the teachers didn't have enough to give him. So, you know, they need something kind of like.
You might need a little more, some of the activities that are more tailored to his, because a lot of times kids, you know, when you've got a group of kids, everybody learns at a different rate. And if he's quicker about it, then his teacher might need to be giving him, tailoring it more specifically to him. And I know that that's difficult to do when you've got a class full of people.
Yeah, I kind of told her that, and then she told me I was trying to do a job. I said, hey, lady, I'm trying to help you out.
See, don't make me flip tables. All right, so, one of the things with hyperthyroidism, some of the symptoms is high blood pressure, sweating, and you know, an elevated temp, even though he's not sick per se. His temperature might run a little warmer than normal. I am concerned that, you know, with the Ritalin also increases your heart rate. Ritalin also increases your blood pressure. So the doctor is wanting to stop the Ritalin.
Okay.
And we're not really concerned about, because Ritalin's one of those drugs where it gets into your system, it does its job, and then it's out of your system. So it's not something that we really are concerned about, any kind of withdrawal or anything like that.
Okay.
The medication that they're wanting to put him on is going to have similar effects in slowing that heart rate down
Okay.
and keeping his blood pressure within a normal range.
Okay.
And I noticed that he's doing some OTC caffeine stuff.
Oh yeah, yeah. He loves that coffee.
Okay, well, see, I do too, but.
Now that granted, I don't give it to him. He sneaks and get it. He has his older brother, and he sneaks and give him that crap.
All right, so older brother is gonna have a talking to, okay? Because because the thyroid affects the heart rate in the way that it does, we really need to kind of keep any kind of stimulant, caffeine, chocolate, things like that. We need to kind of keep that out of his diet. If you find that the medicine that he's taking for the hyperthyroidism isn't managing his ADHD type symptoms, you might want to talk with your doctor about a non-stimulant ADHD medicine.
You got one on hand, maybe?
No. Well, Strattera, they've taken Strattera itself, but it's still available in generic form.
Okay.
So I might would talk with your primary about perhaps a non-stimulant ADHD med. The propanolol, what they're going to probably want you to do is taper that back, because with the medicine that he's going to be getting, it's going to be controlling these symptoms that he's been exhibiting. Okay, so they probably, after he gets to that therapeutic level with his new med, they're probably going to want to taper that propanolol back.
So which med he's gonna put him on?
So what I'm seeing here on the chart is tapazole, and it's something that inhibits the thyroid hormone. It blocks the iodine oxidation. Now with this, you're going to have blood tests every 4 to 6 weeks.
Okay.
Going to be checking his level, making sure that it's at a therapeutic level. We're going to need to check his liver enzymes because it does sometimes have an adverse effect on the liver. And it's one of those things that you have to give it at the same time every day. Now,
so if he's having problems with his liver, what are some things I need to be looking for at home?
well, okay, so jaundice, of course. Any yellowing of the sclera, if the white part of his eye starts looking a little yellow, then you need to be concerned about that. It does need to be given at the same time every day.
Okay.
Now, if it were me, and I was starting this new med and he's still having to go to school and this and that, probably what I would do is he should probably take it with food, okay? I would probably give it with his evening meal. That way you can keep an eye, you can kind of monitor how his reaction to it is. And that's just me. You do it whenever is going to be most convenient for you.
I think that would be better, so if it's a daily medicine or whatever, and you wanna make sure you just get the same effect, so I can give it to him at night.
Yes.
Okay.
Yes. And if you give it, say you eat dinner around 6 or 7, then the therapeutic effect of it with the anxiousness and the restlessness and the heart rate and everything like that, that should carry through until that next dose. Now it'll probably take a week to start seeing some effects of it, which, that's good. At least you're not having to wait a couple months for it to reach its, to see something, to see some kind of improvement. It may take a few weeks for it to get to that therapeutic level to where you're seeing a significant decrease in all of his symptoms.
Now, am I gonna have any problems with him, like growth-wise or whatever, for the medication or just in general?
So hyperthyroidism, it will kind of inhibit, like with the weight loss and everything like that. It also affects bones.
Okay.
So he's going to need to be doing some vitamin D, some calcium. And as far as his weight loss, what you're going to want to do is do like a higher calorie, higher protein, smaller meals, because I know with the, with him not being able to kind of focus right now, it makes it difficult to say, all right, let's everybody sit down and have a meal, and then, you know, halfway through, he's, you know, on hyperdrive and wanting to go and do the things. So some smaller meals throughout the day, snacks, make sure that they're high calorie, high protein, because his metabolism is in overdrive.
So what would be like some good snacks for him?
So some good stuff for him would be things like lean meats, chicken, beef. You really kind of want to stay away from fish, because fish, iodine is part of the whole hyperthyroidism.
Oh, wow.
Okay,
He's
so
not gonna eat shrimp.
yeah. So you really want to kind of stay away from shrimp and fish and even iodized salt.
So yeah, I'm gonna bring him to you, and y'all fight that out, because.
Yeah, all right.
Yeah,
That's
fight
all
that
right.
one.
We will figure it out. But yeah, you were really kind of, when you cook, make sure you've got the non-iodized salt.
Yeah, which I do, or whatever. But yeah, him and his grandmother, there's their thing, like on the weekends, they go to like the big seafood buffet, so.
Oh. All right, so, I've heard of this char place, right? And they've got really good steaks, and they really do have really good steaks. Tell grandma, we're gonna have to change up the thing.
Yeah, so I'll sit down, and that's my mom, and she wants what's best for him, so.
And that's good, that's good. Well,
she kinda like pulls and talks to him.
I'm glad that you guys have a support system, because it is going to take everybody in the household making some adjustments.
Now I have to kill my son, the oldest one.
Yeah,
because he
well,
don't
send
think
him to me, and we'll have a sit down talk.
But you know, like they have that brotherly thing, you know, go to Pizza Hut and,
Oh, yeah.
you know, and stuff like that, and,
Well,
yeah.
so the thing with that is, you don't want to take everything away
Yeah.
at once. What you can do is introduce these foods in different ways and different recipes, and see what works best for him.
Okay.
I know that kids are not really good with things like broccoli and cauliflower.
He loves that.
Oh, great. Well, okay, we'll see. So broccoli and cauliflower, cabbage,
Smoked with cheese.
you know, that's how you gotta do it.
Yeah.
That's how you
That's
gotta
how
do
you
it.
do.
Because dairy is actually
Mhm.
a good thing for him.
Okay.
It will also help with the vitamin D, the calcium, all of that, okay?
What about if I give him like the gummies, the vitamin D gummies, or?
Well, if you decide to do something, I see that he's already on like a multivitamin.
Yeah, he's on like omega-3.
Okay, and that's, so he doesn't have any kind of like a, you know, I still eat Flintstones.
Well, yeah, that's what I was thinking about too, or whatever, but the thing is with that, you know, it has that sweet kind of taste, sweet tart kind of taste, and he loves that kind of stuff, so I know I'm gonna have to like really hide that.
Oh, yeah.
If we start with Flintstones, so I think if I do like the gummies, or
Let's
like
see.
that, he'll just.
My kid would be like, Lala, I haven't had my, you know, and so I would have the same issue. All right, well, if you do start something like that, then I would make sure to let your primary know
Okay.
what they're taking, anything over the counter. Make sure that your doctor knows, so that they can be monitoring those levels as well. We do want to DC the Ritalin,
Okay.
and we do want to DC any kind of OTC caffeine stuff.
Yeah.
And I know that, you know, I'm a big coffee drinker too. I try not to do the energy drinks, but it seems to help on certain things. The propanolol, we're gonna get with the primary, and once his levels get to that good place, might wanna taper back. All right, so with you being a nurse,
I deal with psych people.
oh, fun. See, now I feel like I could do that. All right, so there's something called a thyroid storm.
Okay.
Now that is, so his immune system isn't like everyone else's immune system because of his thyroid.
Right.
So if he gets an infection, it's gonna go to the nth degree with him.
Okay.
He's going to have a fever that you can't get to stop. He's gonna have sweating that won't stop even if he's laying down. Confusion, sclerosis, these are things that if you notice any of those, the fever, the restlessness. This is something that could be a medical emergency, okay? So get him to the PZR so that they can get that squared away. Now, if he does experience a thyroid storm, they have meds
Okay.
that they can give him to kind of bring him back that will inhibit that T3 and T4.
Is this something that would probably have to be put back in the hospital for you, maybe?
It's possible. It's possible that he would need to spend a couple days getting his levels back in a manageable range, but it's something that, you know, I just have to stress the importance of if he has any of these symptoms,
Okay.
go ahead and get him to the doctor.
So he normally runs about 98.9, so I need to try to get concerned if it's like a 1 to 2 degrees higher than that. I mean, just put him on in.
Yeah, I would, simply because that fever, it's all part of the metabolism. You know what I mean? His metabolism is gunning, buddy. It is just getting after it, and so his heart rate's gonna go up, and his metabolism, he's gonna be vibrating essentially. And all of that vibrating is burning off all of that's why I was talking about the smaller, high calorie,
Right.
high protein meals. And I know that he's wanting to do, and this sucks, and I'm so sorry. I know that he's wanting to do soccer, and I know that he's wanting to do football.
Yeah.
Okay. Right now, until we can get him to where his levels aren't just so out of whack, he really needs to be in a low impact type of sports scenario. And he's young, which is good because by the time he gets,
Well, he likes chess and checkers.
well, bless his heart, he is smart, isn't he? Yeah, by the time he gets to where his levels are good, he's gonna be through the little awkward 12-year-old, and he's gonna have already put on a little, you know, and so he'll be ready at that point in time to get out there and do it. But in the meantime, if we can kind of keep him out of that, because it's going to put a lot of stress on his body, and that's something that we're trying to avoid. Nighttime. Have a
He does. He puts himself to bed. He goes to bed between 7:45 and 8 o'clock.
Oh, bless his heart. Okay, so I'm gonna need a
Yeah,
page out of your parenting book.
We started
because-
that at 18 months.
Really? Okay, all right, well, so bedtime, regular, every night. If he gets to where he's feeling that palpitation, he gets to where he's sweating, he needs to be sitting down. He needs to be taking and resting.
Okay.
Because it's kind of like once it gets started, it's hard to stop that train. You know what I mean?
Yeah.
So, plenty of rest, bedtime at the same time every night, rest when the symptoms happen, no stimulants, no caffeine, no Ritalin. Like I said, talk with your primary about
We'll get with them.
nutrition, increase calories, increase protein, several meals small and often. Up his vitamin D, his calcium, make sure that they're checking those levels.
Yeah.
Okay. We've talked about the food, no iodized salt. Broccoli, cauliflower, cabbage are good. Throw some bacon in with that cabbage.
Oh, yeah,
telling
sure.
you. Okay.
He actually likes Brussels sprouts too, so.
Oh, good. All right. Plenty of fluids because he's sweating a lot. And
Well,
one thing good deal. All right. And let the teachers know.
Yeah.
Let the teachers, the counselors know what he's dealing with, so they can be aware of any signs or symptoms. And like I said, tailor some activities for him so that he's got that mind stimulation, so that it's not just empty energy for him wanting to run. Because, you know, if I'm bored, I'm gonna sit there and fidget. I'm gonna sit there and want to chit chat and whatever, and it's gonna get in trouble. Yeah, and no kicking. no kicking people in the face.
Yeah, so
Okay.
I will sit down and I will make, once we're discharged today, I will sit down and, email the principal, the assistant principal,
Okay,
guidance counselor, and, they actually have a school nurse.
okay,
However, she kinda like goes around and, check on everybody and, kinda like let them know so we can get a game plan going.
all right, and do a journal
Mm-hmm.
and kind of keep up with, his signs and symptoms and what his norm seems to, because you're gonna have a new norm,
Mhm.
okay? You're coming off the Ritalin, and that's probably going to be kind of touch and go as far as his activity level. But this new med, like I said, you should start noticing some of the benefits of it within the first week, and then in a couple of weeks, you'll have the full effect of all of it, okay? And all of this, I know this is a lot of information, but.
No, but you went over it thoroughly with me, so, I kinda understand, and so.
Well, I also have, printouts
Okay,
at the discharge
that's
desk
wonderful,
for
that's
you,
wonderful.
so,
And I'll get a big enough journal, so I'll write my things that's going on, let the teacher write her stuff, so I
Yeah.
can have everything, so the doctors can let me know what's wrong with my baby.
perfect, all right, all right,
Well, thank you,
James,
Chuck.
absolutely,
All right.
nice to meet
You
you.
too.
You guys come see me.